When reporting multiple diagnosis codes, you must pay attention to the sequencing of the codes, not just the codes themselves. This is very important. Quite often, the ICD-10-CM book will actually tell you in what order to report these codes. First, begin in the alphabetic index. Sometimes the ICD-10-CM book will tell you how to properly sequence the codes required. In the alphabetic index to diseases, you may see the suggested codes together, one in italicized brackets, like this example on your screen. Nephritis, nephretic, sickle cell, D57, N08. This tells you that when you are confirming the codes to report a case of nephretic sickle cell, you will need two codes. The D57 code, if correct, would be listed first, and the N08 code, if correct, will be listed second. Of course, you will have to check both codes in the tabular list first. Next, turn to the tabular list. Within the tabular list, look for any instructional notations below the code description. Be certain to check below the 3-character code category, as well as beneath the additional characters when applicable. This notation, use additional code, explains several important things. When the condition applies, you will need another code, in addition to the code under which this notation appears. The other code, the additional code, will be reported or listed after the code under which this notation appears. And the notation is usually followed by suggestions as to what the additional code might be. This is only a suggestion, and this additional code must still be looked up and verified in the tabular list before reporting. The code first notation also tells you several important things. When the condition applies, you will need another code, in addition to the code under which this notation appears. The other code, the underlying disease code, will be reported or listed first before the code under which this notation appears. And the notation is usually followed by suggestions as to what the underlying disease code might be. This is only a suggestion, and this underlying disease code must still be looked up and verified in the tabular list before reporting. The code, if applicable notation, tells you 3 very similar things. When a causal condition is stated by the physician, you will need another code, in addition to the code under which this notation appears. When the notes document a causal condition, the code for that condition must be reported or listed first before the code under which this notation appears. And if the notes do not document a causal condition, you are permitted to report this code as a first listed or principal diagnosis. For further information on these instructional notes, please see the ICD-10-CM Official Conventions section in your ICD-10-CM codebook. Next, turn to the Coding Guidelines, Section 1, Part C, Chapter-Specific Coding Guidelines in the front of your ICD-10-CM codebook to see if there are any guidelines there to direct your code sequencing. Within this section of the coding guidelines, find the specific subsection relating to what you are coding. For example, they may be under Chapter 1, Infectious and Parasitic Diseases, or Chapter 17, Congenital Malformations, Deformations, and Chromosomal Abnormalities. If you find no specific directions for sequencing in the chapter-specific coding guidelines, look for guidance about correct sequencing of codes in the coding guidelines, Section 2, Selection of Principal Diagnosis, Section 3, Reporting Additional Diagnosis, and Section 4, Diagnostic Coding and Reporting Guidelines for Outpatient Services, specifically subsection A, Selection of First Listed Condition. Still no specific guidance? Then the default rules are: the primary reason for encounter or admission is first. When there are multiple codes that are the primary reason for encounter, list the most severe condition first. Then, when there are two or more conditions reported of equal severity, report the codes in anatomical order from head to toe. Any questions? Please ask your instructor. Just email or post to the Q&A discussion forum.